Which of the following is a common sign of a wound infection? And usually when you look at something that's infected, you might look at the inflammatory characteristics. And these usually will include redness, swelling at the site, and then other signs of infection could include pus, having bad, or some sort of discharge, like a yellowish discharge. So let's look at the choices and see what would match the signs that we know to be a wound infection. Option A states decreased pain, and decreased pain usually is a good sign of healing. If the area used to be really hot and red and swelling and discomfort, but now it's not as uncomfortable and the pain is resolving, that's usually a good sign and not a sign of a wound infection, so we can eliminate that. Option B states blue discoloration, and this could be seen with a variety of different reasons. Usually blue discoloration is related to some sort of a cold injury, such as when it's very snowy outside and then there's a lack of circulation to the area, it might appear bluish, or similarly there could be a lack of circulation for respiratory reasons. This is known as cyanosis if the area is blue due to lack of oxygenation. So these are other signs of other injuries, but not necessarily a wound infection. Therefore, we can eliminate option B. Option C says redness around the wound. And redness was something that we listed here as part of the inflammatory process that could be seen in a wound infection. Therefore, redness around the wound can be a common sign of a wound infection. And we could go with that, option C. And let's take a look at option D just to be sure. And rapid healing. And no, rapid healing is something you would see as the wound begins to get better and not currently being infected. Therefore, we can eliminate option D as well. And that leaves us with redness around the wound as a sign of a wound infection, option C.